opportunity today to share the results.
Use the microphone.
Thanks for the opportunity today to share the results of a trial that we ran in Australia, looking at the efficacy of Meloxicam when used in sheep to alleviate pain and inflammation from routine husbandry procedures. A bit of background to this study. In Australia, we have a large proportion of merino genetics through our entire herd. Obviously, the merino is used for wool production, but is also crossed through a lot of other breeds for meat. So what this means is there's a large proportion, the skin of these merino crosses is quite wrinkly, and especially around the breech area, it leads to fecal accumulation and a really high risk of blowfly strike, which is quite common in Australia. So to manage the risk from this skin wrinkle around the breech area, there's a procedure that we call mulesing that we use quite commonly in Australia, and it's an in-field surgical procedure that removes a strip of skin from either side of the breech in young lambs. So what happens with this is when they heal, it's quite a smooth area and it's without wool and without wrinkles, so that means the risk of fecal accumulation and blowfly strike is greatly reduced. Traditionally, lambs are tail docked and castrated at the same time as this procedure is done. And traditionally it's been done by farmers or contractors for the farm without local anaesthetic or pain relief. So we know that this has productivity implications for the lambs, so they do take a hit in their growth after they've been through these routine husbandry procedures. So we also know we're creating a level of pain with these procedures. So if there's a way that we can manage these risks, then that's great in terms of welfare for the animal, but also implications for expectations of the consumer and international trade. So that led us to looking at this trial, and the trial was really instigated because Meloxicam 20, which is Meloxicam, was recently approved for use in Australia, Canada and New Zealand in sheep. So we wanted to look at the effect of using Meloxicam in these routine procedures in a field environment. And what we were doing with this was measuring behavioural signs of pain. So we looked at tail docking and castration with a ring and mulesing as well. Our hypothesis with this was that the lambs that had got Meloxicam 20 were likely to return to normal behaviour sooner and show less pain behaviours overall than those lambs that didn't receive pain relief. So with our trial, we ended up using 84 crossbred lambs, so crossbred merinos. They were around about 17 kilos in weight when they were put into the trial. We ran this trial in southwest Victoria, so it's a southern state of Australia on the eastern seaboard. We used a randomised block design with 3 treatments, and they were blocked according to weight into 4 replicates. So we had 3 treatment groups. So one received Meloxicam 20, and interestingly, the dose for sheep is 1 milligram per kilogram, whereas in cattle it's half a milligram per kilogram, so it's double. So they got that subcutaneously under the skin 20 minutes prior to the procedure. We had a placebo group that received the same volume of saline under the skin 20 minutes prior, and then we had a control group. So these lambs were put into the handling facility and spun around in the facility as per normal, but they had no procedures done. So they were our control group. So what we did then was we let the lambs move from the handling facility back to the paddock, and we gave them about half an hour to settle before we started our observations. The observers that we had were blinded to treatment, and what they did was scan sequentially, looking for each lamb within the block over 25 minutes. So these lambs just had numbers written on their side so they could be easily identified. And this scanning was repeated hourly for 8 hours on the first day, and then for an hour on days 2 and days 3. The analysis that we used, so each behavioural observation was assessed by fitting a general linear model using a logit transformation and binomial distribution. So treatment and observation periods were used as fixed effects, and block, lamb, date, observer were random effects. And each behaviour category was treated as a binary function, so that was a yes or a no. So this is a very standard sheep enterprise for us in Australia, where the sheep are on the paddock 12 months of the year. So this is our observer here doing their scanning, and what we were looking for was 4 main behaviours. So we're looking for normal behaviours and what we would consider pain behaviours. So normal standing is a standing without any obvious abnormality, whereas hunch standing is they've got a rounded appearance with an arched back and their head is lower than the highest point of the back. Then normal walking, so that's where they're just walking around with a smooth, even gait, no obvious hesitation. Or stiff walking, so lambs are either stiff when they're walking, they're tentative to move around and quite sort of awkward in their movements. And just our data sheets here. So when we look at our results, we did have significant results for what we consider our normal behaviours and also our pain behaviours. So overall, we had a significant result in the lambs that were treated with pain relief compared to those that didn't in normal walking. For normal standing, we had a very strong trend, just not quite significant there. When we look at the overall results, so the proportion of lambs being observed over the entire period of the trial, when we look at those lambs that receive pain relief, they very closely resemble our control. So that's giving us a really strong indication here that the pain relief is making a difference to them. When we look at our pain behaviours, again, we had some strongly significant results in both, and we see that those lambs that didn't receive pain relief certainly exhibited a high proportion of pain behaviours throughout the trial. So if we break this down a little bit and look at sort of what happened over the observation periods, for the hunch standing, so a pain behaviour here, we can see that overall that there was a large proportion of lambs that didn't receive pain relief are showing pain behaviours, and those lambs that did receive pain relief very quickly reduced the percentage or the occurrence of behaviours. And what happens over time is that the lambs that receive pain relief are closely resembling our control group. And certainly after the first observation period into the second and third, they were indistinguishable from our control group. If we look at stiff walking, again, very similar. So those lambs that didn't receive pain relief are showing a high proportion of pain behaviours that certainly extend out through the whole observation period. Those lambs that did receive pain relief, the occurrence of pain behaviours drop quite quickly and again, over time, become almost indistinguishable from our control group. So that's giving us confidence here that the pain relief is providing a benefit. When we look at normal walking, again, those that didn't receive pain relief are showing pain behaviours through the whole trial, and we do see quite quickly over this period here, those lambs that received pain relief are indistinguishable again from our control group. So these lambs are feeling better a lot quicker and able to return to normal faster. So when we put this together, in lambs undergoing routine husbandry procedures, we know that Meloxicam 20 significantly increased the incidence of normal behaviour in lambs that were given pain relief compared to those that didn't. So this is really important because we're allowing these lambs to return to normal faster. So that means that they're back on their mum's feeding and they're likely to take a less of a growth check going forward after these procedures. We also know that Meloxicam 20 significantly decreased the incidence of pain behaviours. So we know that by giving these guys pain relief for these procedures that we're able to reduce the amount of pain that they're feeling. And this has implications for certainly their production because we know they're going to recover faster, but also in terms of managing their pain and welfare. So these routine husbandry procedures are procedures that we need to do in terms of management. We have to do it for a benefit to them. But if there's a way we can mitigate the pain that they feel in these procedures, then that's absolutely better for the animal and certainly has production implications for us going forward. And in terms of trade and the expectation of our consumers, this is really important. So one of the nice things about this trial is we use it a lot with farmers now that this Meloxicam has been registered to say that in a field situation, if you use this medication, your lambs are going to be a lot more comfortable and they're going to recover faster. And for a lot of them, when they're looking at the cost benefit of treating lambs routinely, so the expectation with this in Australia is every lamb that undergoes a routine husbandry procedure, which is pretty much all of them, will receive some kind of pain relief. So now that we have a study here to say that we know that this makes a big difference to your lambs, looking at the cost benefit, you can say we know we're going to make a difference, they're likely to recover faster, and in terms of production, that's got to be a good thing. So overall, our conclusion was that Meloxicam 20 should be considered an important tool in managing the welfare of lambs undergoing routine husbandry procedures.